Welcome to Lecto. Today we are going to discuss a very important topic, and that is shock and its type. So basically it is an emergency situation, and whenever you listen the word shock, it's mean that you are talking about hypoperfusion, in which you will see our tissues of the body will not get proper oxygen, and ultimately they go toward the hypoxia and ultimately hypoxic injury. It includes all the tissues of the body, tissues of the lungs, tissues of the heart, tissues of the GIT, tissues of the kidney, tissues of the brain, all the tissues of the body. So it's mean that it is something related to the deficiency of the oxygen, less supply of the oxygen, that is the shock. So most important thing in the shock, you will see the hypotension, low blood pressure. That's the most important feature in the shock, that is hypotension, low blood pressure. You will see in the shock. Okay. And after that, due to the low blood pressure, you will see hypotension. It's mean that the oxygen is not provided to the tissues properly. Okay. And ultimately hypoperfusion, it will go toward the tissue hypoxia. Tissue hypoxia. Okay. Low oxygen supply to the tissues, and ultimately it can go toward the tissue injury. It can be either reversible or irreversible. That's the most important thing. And it includes again tissues of all organs of our body. That is actually the shock. There are several reasons in which you will see the shock. You can remember it by the C, H, A and S. C for cardiogenic. When there is a defect in the heart, that it can go toward the shock. That's the most important thing. H for hypovolemic. When the blood volume reduce due to several reasons like accident, like trauma, like vomiting, diarrhea. So you can also, it can also go toward the shock. Anaphylactic, when you will see the hypersensitivity reaction type 1 activated in our body, then it can also go toward the shock. Neurogenic, that is something related to the neurons, so it can also go toward the shock. And ACE for, that is the septic, when you see the bacterial infections in the blood, so that can also go toward the shock. And in the shock, as we have discussed, in the shock you will see the hypoperfusion of the tissues of our bodies. Okay, if we discuss the different types, that will clear our concept. So first of all, we will discuss the cardiogenic shock. It means that is involvement of the heart. So whenever there are different situations in which you will see the cardiogenic shock, whenever you see the MI, myocardial infarction, heart attack, and ultimately you will see in that situation, you will see the hypoperfusion, that can also go toward the shock. Okay. Arrhythmia, that can also go towards the cardiogenic shock. Okay. Cardiac tamponade, in which you will see the accumulations of the fluid, excess fluid in the pericardial space or pericardial sacs, that actually put pressure on the heart. So in which you will see the low cardiac output, and that is the most important thing, low cardiac output, and ultimately you can say the hypoperfusion. Okay. And you can also see the pulmonary embolism, so in which you will see the pulmonary artery blocked due to some thrombus. So actually, if you see, as you see, this is the heart. Okay, that's the most important thing. So actually, you see the arise of the pulmonary artery, or you can say pulmonary trunk. Whenever you see there is a blockage of the pulmonary artery due to some thrombus, so ultimately the blood cannot go towards the lungs. Actually, pulmonary artery go towards the lungs, and whenever the blood, there is an obstruction in the flow of the blood towards the lung, then blood will not get proper oxygenated, and ultimately oxygen is not properly supplied to the tissues of the body. That can also go towards the cardiogenic shock. So here are basically these two, actually myocardial infarction and arrhythmia. There is a defect in the muscles of the heart, and in the cardiac tamponade there is a, that is actually there is a defect in the pericardial space fluid that exert pressure on the heart, and that is the obstructive reasons. Okay, next if we discuss, that is the hypovolemic shock. That's the most important thing. Hypovolemic means low volume. Hypo means low, volemic means volume. So whenever you see the low blood volume due to any reason, you can call, that is the, it can go toward the shock, because when there is a no proper blood volume is present in our body, so ultimately proper oxygen will not go toward our tissues or our different organs. So ultimately you will see the hypovolemic shock. That's the clear cut point. Okay, so if you see the hemorrhage, you can say that loss of the blood in from our body, that the most important reason, or you can say loss of the fluid. That can be any reason, like you can say diarrhea. Okay, due to diarrhea you will see the loss of the, or reduce in the volumes of the blood due to the release of the different electrolytes from our body, and vomiting, but in severe condition, vomiting, or you can say trauma. Okay, and you can say during the burns patient can also go towards the hypovolemic shock. Okay, and third one is the septic shock, in which you will see the sepsis. That is something related to the bacterial infections. Okay, that's the most important thing. So the most important is the gram negative bacteria. Gram negative bacteria actually involves, because gram negative bacteria have endotoxin. Okay, that's the most important thing. If I say there is a bacteria and this bacteria has endotoxin in its cell wall, so this endotoxin actually play an important role in the cause of the septic shock. Okay, you can also say that the gram positive can also cause the septic shock, but the major role is the gram negative, because gram negative has endotoxin that is actually called the lipopolysaccharide. That's the most important role of the bacteria in causing these septic shocks. Okay, or you can say fungus can also goes toward the cause the septic shock. Okay, so ultimately in all situations you will see the hypoperfusion, low blood pressures, hypoperfusions. Okay, and ultimately you will see the hypoxia, and ultimately the tissues can go toward the reversible injury that can be revert back, and the irreversible injury that cannot be reversed, and the ultimate is the death of the patients. Okay, and next is the anaphylactic shock. That is the due to the hypersensitivity, activations of the hypersensitivity type 1 hypersensitivity. That's the most important thing. So in anaphylactic shocks you will see the most important cell that is actually involved is the mast cell. Okay, that's the most important thing. Mast cells have receptor for the, here is the receptor for the IgE antibodies. Okay, that's the most important thing. Here is the IgE antibodies. Okay. So whenever you will see the different pollutants and allergens enters in the body, so it is detected by the IgE antibodies. Okay. So IgE antibodies will attach to the receptors of the mast cells. Okay, and these antibody attach the antigens that can be any allergens. Okay, when they attach, these will activate the mast cells and release of the different cytokines. Okay, from the mast cells, release of cytokines. Okay, that cause the anaphylactic shock. So due to this release of the cytokines, you will see the vasodilation. You will see most important vasodilations. Blood vessel dilate and the blood will prefer to stay in the tissues of the body, and ultimately when you see the vasodilation, the proper blood cannot go towards the heart, and ultimately the cardiac output will become low. Low amount of the blood will be pumped by the heart. So that is the vasodilation, and ultimately you will see when proper blood cannot go toward the heart, it means proper blood cannot go toward the lungs and proper oxygenated cannot happens in the lungs. Okay, and next is the, that is the neurogenic shock. That is something related to the nerves. So in the neurogenic shock, you will see that there are several reasons of the neurogenic shock. You can say anesthetic accident, when you give the improper anesthesia or in the before the surgery, then the patient can go towards the neurogenic shock. Or when you see there is a defect or injury in the spinal cord, you can also see the neurogenic shock. But why you see the neurogenic shock? Because when there is a damage of the nerves. Okay, if I say here is the blood vessel, okay, specifically arterioles, because arterioles have large supply of the neurons. Okay, nerve supply. So actually if you see, here are basically the nerve supply to the arterioles. Okay, whenever that actually maintain the muscle tone of the blood vessel. Actually proper blood flow through the arterioles when the proper signals come through the neurons, because the muscle tone is actually maintained by the neurons. Okay, when you see the cut of the neuron, damage of the neuron, so the muscle tones of the arteriole will disturb, and the ultimately the blood pressure reduce in the blood vessels. So ultimately due to these reasons, the patient can go toward the neurogenic shocks. Proper blood cannot go toward the heart, and you will see the reduce in the cardiac output, and ultimately you will see the hypoperfusion. So here basically the reason that when the nerve damage, muscle tone is disturbed or lost, and ultimately you will see the blood pressure is reduced. Okay, here are basically the different 5 types of the shock. If we discuss the stages of the shocks, so 3 most important stages. First one is the non-progressive. Progressive, it's mean it is not something related to the progression or spreading of the shocks. So in the non-progressive stage, you will see the activations of the compensatory mechanism that compensate the cause of the shock. So it is actually the compensatory mechanism. Okay, what type of compensatory mechanism? Because in shock you will see the hypotension, so we have to increase the blood pressure. That is the most important reason. So how can we increase the blood pressure? There are several mechanisms that actually happens in our body to maintain the blood pressure. So most important is the, if I say, that is the baroreceptor reflex. Okay, actually, from the medulla you will see the signal comes through the sympathetic pathway to the baroreceptor that are actually present on the aortic arch and the carotid artery. So that will actually help in the increase of the blood pressure. So ultimately when blood pressure increase, then it most of the chances that the tissue will get the proper oxygen. Okay, next is the, you can say, activation of catecholamine, release of the catecholamine, epinephrine, norepinephrine, that actually help in the maintenance of the blood pressures. Okay, or you can say activations of the renin angiotensin system that also help in the maintenance of the blood pressure. Okay, and you can say activations of the sympathetic nervous system, that is actually in fight and flight response. So in sympathetic nervous system you will see the blood pressure starts increasing, or vasoconstrictions of the peripheral blood vessels, and ultimately it help in the maintenance of the blood pressure. And last is the release of the antidiuretics. So there is a reduction in the productions of the urine. When there is a reduction in the productions of the urine, so ultimately the blood volume is maintained, and that is actually help in the increase of the blood pressure. Okay, when this condition first stage is failed and the patient go toward the second stage, that is the progressive stage. Now in the progressive stage you will see the hypoxia. Okay, that is the most important, hypoxia of the tissues. So if I say here is the tissues, so in the tissues of the body you will see normally process, you will see aerobic respirations. Respiration happens in the presence of the oxygen, but due to hypoxia, low supply of the oxygen, cell convert into the anaerobic respiration, and due to the anaerobic respiration you will see the formations of the lactic acid. Whenever you see the lactic acid production, you will see the most important, that is acid, and you will see the metabolic acidosis in that situation, that is the metabolic acidosis. Okay, and ultimately due to the metabolic acidosis you see that it will affect the vasomotor mechanism or vasomotor reflex that actually supply to the blood vessel. When the vasomotor reflex is disturbed, so ultimately you will see the muscle tone of the blood vessel is lost, and ultimately you will see the pulling. Blood will prefer to stay in the peripheral blood vessels, and blood cannot proper go towards the heart. So ultimately due to these reasons, pulling of the blood in the peripheral tissues, you will see the low cardiac output, and there is no proper oxygenation, and in that situation you will see the hypoperfusion. Okay, another important thing which you have to remember, whenever the blood prefer to stay in the peripheral blood vessel, so in that situation oxygen is not actually present in the blood vessel, so actually the endothelium of the blood vessel will start destroying, or injury of the endothelium of blood vessels due to the hypoxic injury. So ultimately when you see the injury of the endothelium of the blood vessel, so collagen will expose, and ultimately you will see the start of the coagulation and formations of the clot. In different parts of the body you will see the formations of the clot, and ultimately you will see the DIC, disseminated intravascular coagulations. Okay, and last is the irreversible. Now this situation cannot be reversed back to normal. So in that situation you will see the necrosis, injury of the different organs like brain, liver, heart. So most of the organs actually affected by this. So you can say kidney, necrosis of the kidney, tubular necrosis, acute tubular necrosis that happens suddenly. And due to acute tubular necrosis, you will see what type of symptoms? Oliguria, or low output, urine output, or you can say urea, that is absence of the urine, because the kidney has been damaged due to the acute tubular necrosis. So ultimately you will see the oliguria. And similarly liver can also damage, and you can say brain, or you can say, so necrosis starts happening in different organs. So ultimately there is a, if most important two organs, heart and the brain, most affected by the heart and the brain cannot be reversed. Instead other organs can revert, but ultimately in that situation, in the irreversible state, most of the chances that the patient will go toward the death. So this is all about the shock and its type. If you still have any question, you may ask in the comment section. Thank you so much.